Hi, everyone. Welcome. Give it a second while everyone is joining. Hope everyone's week is going well.
Yeah, it is.
Good. All right, so we can go ahead and get started. Hi, everyone. Welcome to our session 10 of the Northeast CPI. Thank you all for being here today. It's great to see some new folks in the room. We can go to the next slide. So just a reminder, we are recording today's session, and as always, we will make it available to everyone after the session, so you can refer back to it. Next slide, please. Next slide. So please, if you haven't already, make sure to update your name on Zoom, include the name of your organization. And today our chat icebreaker is to please share your favorite fall activity. I know I love hearing what everyone is up to in these cozy, colder months. So please feel free to put that in the chat, what your favorite fall activity is. And then as always, we really want to have a dynamic session. So please feel free to use the chat, raise your hand, come off mute. And we would really love to get your feedback and your thoughts. And as always, you can always follow up with us in an email as well if anything pops up after the session. I'm just going to go ahead and another webinar. Okay. I'm going to take a look here and see what people are saying is their favorite fall activities. Camping with the fall colors. Yeah, the leaves this time of year are so beautiful. Hiking, baking, movies, seasonal desserts. Yes, that is a big favorite of mine. Well, thank you for sharing. Please feel free to keep putting in your fall activities into the chat. Next slide, please. So we just want to take a moment and just welcome anyone who's new to the collaborative. I think there are some folks here who haven't joined a meeting before. I'm just going to pause for a second, and if anyone who is new wants to come off mute and say hi or put your information in the chat, feel free to do that as well. But if anyone's new, wants to introduce themselves, please feel free to come off mute and say hello.
Hello, Joey Hughes with the Good News Rescue Mission in Reading.
Hi, Joey. Thank you so much for being here today.
Thank you.
Yeah. Anyone else new to the collaborative?
Good afternoon, everyone. Sharuk Tishley from Partnership Health Plan.
Hi, Sharuk. Nice to see you.
Hi, it's Crystal Johnson from Partnership.
Hi, Crystal. All right. Well, thank you to all the new folks and returning folks as well. As always, all of our session materials and resources are available in the folder that's linked here, and you'll have access to this deck after the session. Next slide, please. So the objectives for today are by the end of the session, everyone will receive important updates and resources pertaining to funding opportunities, ECM, Community Supports Guide, and the Provider Registry. We will discuss the lifetime benefit for community supports to clarify limitations and identify any knowledge gaps. We will review and discuss an asset map of ECM and community supports in the region. I think today we'll be focusing on community supports. And then we'll also identify geographic service gaps and brainstorm next steps. Next slide, please. So to give you a sense of how the session is going to go, after we finish up this level setting piece, we'll go over some updates and resources pertaining to Cited, TA Marketplace, the guides, the registry, and we'll get a little bit of feedback on some community-facing materials from you all. Then we'll have our discussion about the lifetime benefit and move into asset mapping. And then also want to highlight that our office hours will be taking place directly after the session. So if you're available, please stick around, especially for any new folks who would like to, get connected to some resources and just get up to date with what we've been doing in the collaborative. Please feel free to stick around. Next slide, please. All right, so our first update is related to PATH cited. And so on January 6th of 2025, DHCS will open the PATH cited round 4 application, which is really exciting. We've been waiting to kind of hear when this would happen. So really happy to be able to provide everyone with that update. The deadline to apply for cited is going to be March 7th, 2025. Additional information, including the application preview and guidance, is available on their website, which is linked on this slide. And then we're also planning for an in-depth cited round 4 application walkthrough. So please stay tuned for that. If there's anything anything specifically that you would like us to cover during that session, please feel free to put it in the chat, or if you think of something later, you're always welcome to send us an email. And then the cited email address is there. If you have any application related questions, you can direct it there. Next slide, please. As always, we want to highlight the TA Marketplace. This is a virtual marketplace for those of you that might be less familiar for technical assistance. It's a one-stop shop website where organizations can access TA resources for free. TA offerings include the option to request custom hands-on technical support, and you can also request off-the-shelf TA projects, which are packaged and ready for implementation. The step-by-step video walkthrough is linked in this slide, and then applications are rolling, and that link is also there as well as FAQs. Next slide, please. We also want to highlight some new resources that Health Begins has put together that are intended to support organizations who are considering or have recently contracted with Medi-Cal managed care plans to provide either community supports or enhanced care management services in California. Those video resources are linked here. So please, if you are interested in those are accessible on this slide. Next slide, please. We also wanted to highlight an upcoming DHCS public webinar. It is hospital engagement in CalAIM, supporting connection to ECM services among eligible Medi-Cal members, and the registration link is there. And I see Melissa is putting these links in the chat as well, so you can access them in the chat as well as in the deck after the session. Next slide, please.
Thanks.
And now, yeah, I'll pass it to Melissa now.
Thank you. So we just wanted to do a quick kind of touch point again on the ECM and community supports guides that we have developed. We did share about these during our in-person meeting, and are also just circling back because we had hosted a ad hoc meeting on how to utilize these, but essentially these are easy to digest fact sheets that can be printed or saved by frontline staff to inform your Medi-Cal members about ECM and community support services they may be eligible for. So these fact sheets actually have the 8 community supports that are available in Shasta, Trinity, Siskiyou, Lassen, and Modoc counties. And also on the reverse side, demonstrate the enhanced care management populations of focus. And so as you're talking with your clients about these types of services and you're looking at kind of the different types of support services that maybe you are not providing, this is a great resource to just have on hand. We've also actually utilized it and shared it with the community, and it has been very well received. And so it's a really great way to just have a quick fact sheet that you can disseminate back out to the community. They might need a little bit of orienting, but we do have this linked in the slide deck and can also share it after. I did want to pause and just ask a really quick question because this is kind of an iterative process in terms of how we've been developing these. Just kind of curious to know whether it would be helpful for us to add in some language into the guide or tag which of these services are once in a lifetime benefits. Just want to do a quick voiceover poll. I see Amber nodding her head. Curious if there's anyone else that would find that information useful kind of in one place or one centralized location. Like if you were to print this and would it be helpful to have that? I see yes. I see a couple head nods and thumbs up. Okay, perfect. So we will go back in and edit these and make sure that that addition is made, and share these back out. Next slide, please. So in terms of kind of opportunities to improve data exchange, we know we've shared this before. We have been working on a provider registry, and at this point have been able to actually collect a good amount of information from all of the providers within the region and continue to encourage all of you to fill that out. As we build out our web page, this will be housed on our web page so that you can download an Excel spreadsheet that will be demonstrated in the next slide, for you to really understand what providers are in your region, what counties are served, their contracting status. We know that partnership has this available, and sometimes those can be a little bit hard to navigate. And so this will also have some filtering settings. But we can go to the next slide and I can share more about what that will look like. So essentially, you will have organization information, you'll have the referral coordinator contact information. So when you're filling this out, we do ask for your actual referral coordinator's information and not just the general information for the organization. We also ask for your email, your contracting status, and then the ECM populations of focus and community supports providers. So when you download this as an Excel or forms kind of sheet, you can go through and add filters and kind of review who is in Shasta, Lassen, and or Modoc or Trinity. Before I close out on this, also want to just do again another verbal poll. Would it be helpful in upcoming sessions for us to actually demonstrate how this can be used and how you can navigate through it? Yes. Anybody else? And if you're nodding your head behind the scenes, I can't see because your cameras are not turned on. Shannon said yes. Okay. Perfect. And we can also do this during an office hours. So if you would prefer to just have it done during office hours, let us know and we can do that. I think I'm going to hand it back to you, Eva.
Yeah, thanks, Melissa. Next slide, please. And also I dropped the link to the most updated version of the registry, so you can take a look at that now. And then if you have any questions, feel free to put them in the chat. But we just want to take a moment to ask if any of you have any updates or spotlights you'd like to share with the group today. So I'll just pause and see if anyone has any updates.
I have a couple for Shasta Community Health Center. So we're located in Shasta County. We are serving the justice involved population now and also youth focused population. So if your agencies are at capacity with those, or you're getting referrals for that population and you're not set up for that yet, then you can refer them over to our agency.
Great, thank you, Amber. Any other updates or spotlights or success stories you'd like to share with the group? All right. I'm going to take this moment to ask another question of this group. I know that we are working on some sort of CalAIM 101 resources, really sort of covering all of the basics of CalAIM. And we wanted to know, according to you all, do you think it would be helpful to also create a CalAIM 101 resource that is intended to be community facing? I know we've been talking about that a little bit more kind of with the guides in terms of how you all talk to your communities about community supports and enhanced care management, but just wanted to get a sense of if that would be a helpful resource, developing a CalAIM 101 presentation that is intended to be for the communities or for your clients or members.
Maybe instead of a presentation, like some points we could put on like our website or other social medias that our organizations use, because sometimes it's hard to know like how you would use that presentation. But a lot of agencies now have forms of social media, so it could just be like maybe like quick tips, or how to do a referral, or some sort of general stuff that people could put on their social media.
Yeah, I love that idea. Thanks, Amber. Any other thoughts about what would be helpful in terms of a community-facing resource?
I have a question. So when you guys are doing your outreach for ECM or CS, what do you feel is something that you don't aren't able to verbally explain as you're doing that outreach, or where maybe some of the gaps in terms of your own education or what you're observing from the community?
I may not be saying this right, so Shelley, feel free to correct me, but I know one of the things we often run into is our population feels like short-term post-hospitalization is like a way, it's focused on housing, like, so it's a way for them to get housed for 6 months. And that is a component of it, but there's like other parts you need to be doing as well too. But people kind of hear the 6 months of free housing. And I think that like we have heard through the grapevine that it's like, well, if you're not going to give it to me, then I'm just going to go to like a different agency until that gets met. And so that would be the one I know we come across with short-term post-hospitalization or like the difference between medical respite and short-term post-hospitalization, because they're like same, but different. So I think those are standouts maybe.
Yeah, that's super helpful. So maybe creating like a document that shows the distinctions and maybe some eligibility and here's how to navigate it. And some talking points. Anybody else on the call? No? Okay. How about I'll hand it back to you.
All right, thank you. And I think we can go to the next slide, and I will pass it over to Amber.
Well, thank you. We're gonna do where'd the there it is. I was like, I lost it. So we're gonna do a live poll, and we're interested to hear how familiar are you with the lifetime restriction that is a limitation of some of the community support. So not at all, slightly, moderately, very well, extremely well. Well, I'll see when those results are in. Okay, so it looks like the majority of us would say slightly. We're a little familiar. 18% were moderately, and you know, the next runner-up actually was extremely well. So that's some good information for us to guide the conversation. Next slide. So what we wanted to make sure to share is these are the community supports that have a lifetime restriction. So housing deposits, housing tenancy and sustaining services. And I do want to just make sure the group knows there's not additional funds attached to this one. Short-term post-hospitalization, the community transition services, which is also the nursing facility transition to a home, the environmental accessibility adaptations, and the asthma remediations. And down here, we have the link to the community support policy guide if you have additional ones. Before I ask my next question, could I see the next slide? Okay, perfect. So going back real quick, by a show of hands, how many is the group familiar with all of those, or are there just some that you're familiar with? If we can click back one slide. So as we talked about, these are the ones that have the lifetime restriction. So just a question to the group is, were you familiar that all of these had a lifetime restriction? Are there some that you are more familiar with than others? In my other life, I'm a therapist, so I'm really okay sitting in silence until somebody responds, just so everybody knows. Oh, Shelly, I can see your mouth moving, but can't hear you.
Is that better? Can you hear me
Yeah.
now? I'm pretty familiar with most of them. I think the only one I'm not familiar with is 5.
Mm-hmm.
And I know we're only using a few of these services as well, but
Thank you, Shelly. Anyone else? Were you familiar with all of them or some? Thank you. I see in the chat as well too. All right, so moving on to the next slide. How do you talk to clients about these limitations and restrictions? What practices does your organization have in place for when participants stop engaging in the lifetime services? So this is an opportunity for us all to learn from each other. So how do you talk to clients about these limitations and restrictions?
I think it depends on which one it is. For the short-term one, I really like to get pretty detailed with my patients that it is once in a lifetime benefit and how we are requesting it and like what is required from them as far as engagement. I like to just be pretty clear about that, especially when you're putting them in a hotel. Like Shasta Community Health Center has policies that our patients sign so that we make sure that they do understand, and we revisit those rules regularly because 90 days for our patients can be a really long time. And sometimes when they're in that fight or flight before they get into that program, they're not going to remember all those things that we discussed with them. They're just focusing on getting into their hotel and getting warm and getting food. So revisiting like those rules and reminding them that it is once in a lifetime and it's limited is really important to keep revisiting.
Thank you, Shelly. Anybody else who's using these services have a practice in place? I'm going to scroll down, make sure I'm not missing anybody. Okay. So, Shelly, hate to call on you, but since you answered the other ones, and it looks like we also have a question in the chat from Gretchen. Do we ever have clients that will turn down the service once they know it's a lifetime? So has anyone had that experience that they'll turn it down?
Yes, I have. I like to go over like all the other options that we might have, like if it is like related to like medical care, if recuperative care would be something that they'd be interested in, like what is the barrier holding them back from wanting to use it, and also like respecting them that they don't want to use it. They might need to use it later, and still trying to solve that same problem or work on that goal in a different way.
Perfect. And then does your organization have any practices in place when people stop engaging or you lose them when they're getting one of those lifetime benefits? Shelly, you came off mute. Do you want to answer that one?
I know. Yeah, I was like waiting. I didn't want to like just jump in, but yeah, we have quite a few policies in place when we lose somebody. Outreaching for patients is really important, like 3 different types, 3 different ways. We're looking for them at the hospital. We're looking for them at the mission, old camps that they hung out at. Once we put them into a hotel or other program as well, we like to know like where they most frequently hang out. If we can't find you here, like where can you be found? Also letting them know where we're located is important. Like we have the Hope Van. They can always show up at the Hope Van or at any one of our clinics to look for us. If their phone dies, anything like that, there's just so many things that can be done. Usually our patients are pretty good with resources, and if they want to find us, they will. But also knowing like where we are is really important too.
Thank you. So a couple things I want to just call out for folks is I think when you're doing short-term post-hospitalization, if you're utilizing hotels for that temporary housing or even perhaps a house you guys have purchased, I really encourage people, if you know that person like really struggles with consistency or hygiene or you know, visitors or like whatever the rules you're going to have for your program. If you already know that they're having a hard time with it, you might want to slow down the process and really make sure that they're going to be able to be successful. And definitely with housing deposits, like partnership does require us to submit a housing plan. However, this is once in a lifetime funding. So if someone doesn't have like the ongoing resources to be able to maintain that housing, I really encourage you to just slow it down. We can get really focused on getting people housed, that we sometimes forget the second chapter is keeping them housed. So really making sure that their budget, like the sustainability and the support is there. So those would be the two things I would just encourage. Those are things that you can find on TA Marketplace as well too, like trainings around them and how to have those conversations. But those would be my call outs. Next slide. Thank you.
Thank you, Amber. That was really great. I learned a lot. So now we're going to move into our asset mapping section. I'm actually going to go back to one slide now, Meet. There we go. Thank you. So I wanted to jump into a conversation with everyone today to continue our work on referral coordination. Back in the early part of this year, the collaborative did identify that we really wanted to work on referral coordination, and we've been trying to chip away at some of those pieces over the past several months, and we're going to continue to do that today. So if we go to the next slide, we've done a couple things that hopefully will help with this conversation, will help build some more networks too amongst providers here in the different counties that we're working in. One of them was back in our June session where we sat down and talked about who are the providers who are missing from our collaborative table, who want to bring in either as contracted providers or as organizations that could be good referral partners, or who are just important stakeholders in our community. And we have this great list of things, of organizations, that we came up with. And I know we had some folks who actually reached out to people to see if they'd be willing to join our conversation. Joey, I think you were on this list, and now it's nice to see you here. May not be connected, but I'm going to just go with it. So it's great to see all this, and we hope that over the next several months, you'll continue to do outreach. We want to build up our collaborative. We want it to be a central point for folks to talk about ECM and community supports in our counties, share information, share knowledge. At our last in-person session in Lassen in September, we had some really great conversations with potentially new providers and potentially new referral partners. And I think those are important to keep having. And if we can bring those into the collaborative, that's a great space for it. So I'm going to encourage folks to keep using those invitations, keep reaching out to folks you encounter in different meetings, and encourage them to come join us in the collaborative here. We also created a provider registry, which Melissa talked about a little bit earlier, but we hope you'll use that. We have more folks who are adding in their information, but we hope that will become a more robust place to share what services you're providing, what counties you're working in, who is a referral contact if we want to talk about referrals with different organizations. So we hope that will continue to grow as well. Now we want to do things a little bit differently and start to look at who are the assets we have in our counties. Assets are probably going to be mostly you guys here, our providers working on ECM and community supports. Our assets also going to be Partnership Health Plan, who is making all of this possible. And then we also want to see, are there any gaps that we need to pay more attention to? And we're going to focus on looking at community supports for today and really looking at who's out there doing community supports, which community supports are being offered. Are there any gaps? Do we have services that are at capacity that we could, use more? Let's say beds for recuperative care. I'm just going to throw one out there. Don't know if that's true or not. And start to think about how do we as a collaborative, how do we as Health Begin start to support addressing those gaps? How do we help support you all as the providers in doing the work that you're doing? So that's what we're going to focus on for the rest of our meeting here today. So we'll go to the next slide, please. So we have taken each of the counties that are in our collaborative and looked at all of the different all the community supports, not all housing, that are offered in each county and who the providers are for those community supports. And so if you look at Shasta, we have 8 community supports that are being offered, and we have multiple providers in each community support. Does this look right to folks who are working in Shasta? Let's go to the next slide. We'll look at some other counties as well. So we've got Siskiyou and Trinity here. Oh, and Amanda, I'm seeing your note there. We can update that. Thank you. We're going to see that both for Siskiyou and Trinity, we also have 8 community support services that are being offered. And for the large part, we have multiple providers. There's a few services and only have one. So again, if we see anybody who's missing or any errors, please let us know. But just give a moment for folks to review. All right, we'll go to the next slide. Our last 2 counties. So for Lassen and Modoc, oh, Amanda, thank you. For Lassen and Modoc, just take a look here. Now for Lassen, we only have 7 community supports that are being offered in that county, and in Modoc, we have 8. And I know there are many reasons why we may not have all 14 community supports available in a community. A lot could be tied to workforce, you know, different types of provider capacity. There's many reasons that could be happening. But I just want to give a chance to think about all of these different ones here. Let's go to the next slide as well. So to do a big picture overview, we wanted to look at the 5 counties and put down the providers that are in there. This does not mean that this is where you are in the county, just more that you're in the county here. And I think we wanted to talk about what's missing. What gaps do we have in the community supports arena? So we can go to the next slide, please. So what gaps do you guys see in the counties you're working in for community supports? And please come off mute. Do we have too many medically tailored meals providers in the counties you're working in?
So for me, I don't really know in like Shasta about gaps. I don't think you can ever have too many medically tailored meals, just because I know like we're always looking at resources, gonna be reaching out to Spencer here shortly to like figure that piece out. I think sometimes what it is like how to coordinate with each other and how to like best work to our skill set. I think sometimes that might be the thing more than a gap, but that's just my opinion.
So Amber, when you talk about that, does that mean that we need to think about how we engage with each other differently, how we share information?
Yeah, I think, eventually I think it would be great if, like at the local level, sometimes if there was almost like and I know this always gets into a sticky place, in terms of like sharing information and privacy. So there would have to be like hurdles around that. But if you go back to old whole person care days, which is what prompted, really a lot of the development of CalAIM, is that we'd meet twice a week or twice a month with the county and like talk about referrals and who was a good match. One of the things we tried here locally with a partner, but it just never landed a lot of times because of staffing issues, was to have a once a month meeting where you could get together and be like, hey, our caseload's full, or, we don't think we'd be a good match for this person because they need someone who's more skilled in mental health and we're like more skilled in this area. So being able to figure out like not just who the contacts are, but where are the areas that we do best and we shine in.
That's really helpful to think about. So kind of more of a case conferencing almost.
Yeah, case conferencing. And I don't want to speak for Siskiyou, Modoc, or Lassen, but like I would imagine if you guys don't have a lot of people who can provide short-term post-hospitalization and medical respite, like you guys are kind of stuck in how you'd be able to move forward with like reducing kind of like overuse of your emergency room system. Cause I know it's really hard to get folks placed in those frontier counties. So like, I don't know if we have our Siskiyou, Modoc, and Lassen folks here, but even I know we have some representatives from the Pitt River tribe, and you guys are often also compromised by like how you can get people to like be able to get the help they need in their community of residence. And that can really impact like connection with family, cultural, like all of those pieces that I think are really essential.
So as we think about that, and it's not like in whole person care, it was run through the county, so it made sense for the county to convene those types of meetings. Who might be someone who could convene those meetings today?
As you guys were speaking, and I just really connected some of the dots that we in Modoc County, and part of my team is in Shasta County, not knowing exactly what services are available with the county. And so I think it would be helpful if we could have a meeting with all of the service providers that were on that sheet for our county. It's not that much, and it wouldn't be that hard to gather together and be able to hear what kind of service, what the process is, just a brief, so we have a face-to-face, because some of those services like home care, I don't know who they are. And I'm in a small community that I should know who they are. And so that makes me wonder, are they just getting up and running? How do we refer to them? And it would be nice if we had the people who are the connectors for our providers, right? So our team in the clinic that says, oh, you've got this problem provider, I've got this person, you are ECM, or that type of stuff. I'm seeing that would be very helpful.
No, I appreciate that, Kelly. I think that's a really good idea. And I'm wondering, I mean, we have our provider registry, which has it on paper. It's not the same as face-to-face, and I acknowledge how important it is to meet each other and talk to each other. Who do you think could help with that? Do you think the counties would offer meeting space to providers to come get together, whether it's just once or once a month or whatever we think is appropriate? Or who do you think could start to host some of those engagements?
I think there's meeting space available, and I think it just is the need. I could be the primary person who says, hey, do you guys need this information? And I can find a location here locally in Alturas, where most of our medical services are offered, but extends. I could be that hub to make it happen, because I feel like we go, oh yeah, they need a special diet, but then we went, well, I know that's part of the offerings from partnership, but who do we connect to that will service our population here? And I was thankful we met up with Spencer at the last meeting we had, and we were able to attend that. But I feel like Pitt River, we're a little behind, just because we didn't really have a designated manager for this project. So we've all kind of chipped in and did what we can. And there's a bunch of us trying to figure out, how do we do the billing? How do we set up policies? How do we get all this stuff? So we are really behind. So any help anybody can offer us, we would appreciate that. I have now been designated as the lead to help get our team going. And so anything I can get to educate our providers, to see where we're at. And I think when we filled out our ECM application, we put all these support services that we would provide. But I'm thinking what we're really providing is referrals to some of them. So
that's important too. That's important.
We have a lot of things we look at and go, what were we thinking there? But we're learning as we go, and I'll be the first to admit that I'm way back in where I should be in my learning curve. So don't ever think what you're sharing is not valuable, because it's all valuable.
Kelly, I think it's very valuable. And I remember at our last meeting in Lassen, we had a lot of great peer learnings from the folks who were more experienced in ECM and community sports and those who were still learning. So I think that's really important. And we hope the space can offer that. As big as we can be or as small as we need to be, we can do that as well. Spencer, I see you putting some things in the chat. Do you want to come off mute and chat about how to best reach you?
Yeah, absolutely. Can you hear me?
Yep.
Awesome. Yeah, my email is perfect. I'll throw my number out there as well in the chat here. Call or text works good as well. And if you guys have any more questions or anything, I'm more than happy to email or hop on a call about our services as we're contracted with partnership.
Great. And I'm going to put our partnership folks on the spot here. I know you guys have meetings for ECM providers, for community sports providers. How micro does that get? Is that for all of your providers across all of your counties? Do you ever do county-focused meetings to support the providers?
Oh, sorry. Can you ask that again?
I'm sorry, this is actually for my partnership folks. I was just curious. I know they have provider meetings, but didn't know if they were ever based on the counties or if they are broad across all of the partnership counties. Did we lose our partnership folks?
Hi, this is Sharuk from Partnership, and again, this is my first time joining, and I was having laptop issues. To get in my car, but I will find out because I'm fairly new to Partnership as well. I can certainly find out that information and see how we do that specifically for ECM and CS. I know we have a lot of collaborative meetings and things we participate in and provide support to. So I can find that out and send an email to you all about that.
That'd be wonderful. Thank you so much. I'm glad you called back in.
Of course, thank you.
So sounds like we could use some face-to-face meetings to kind of find out who everybody is in the counties, and if we have providers that are maybe not based in the community, it'd be great to have some representatives that could come and just make that connection for folks. So I think that's something that we can think about doing. Would that just be a one-time event from your point of view, or do you think that could be an ongoing exercise that we want to do more of the case conferencing model every month or however frequently it needs to happen?
I mean, I think quarterly is probably fine. Like if we could, because there's, these meetings, there's the CalAIM office hours, like there's a lot of different ones. So even if just like quarterly we did case conferencing to help build up relationships and then kind of go from there. But I'll always go with whatever works for the group.
And it could vary by county, I'm assuming too, how frequently we, people need to get together. All right, I'm not hearing any more. Are there any, I think, Jim, you're agreeing with Amber that quarterly makes sense, so that's good, good support. So it sounds like we have a need to really, a gap we have is personal connection, so getting folks together. What are the other gaps? And I like that we're broadening the gaps, not to be just about what providers we're missing or services we're missing, but thinking about the mechanisms that we're missing to really help these programs be successful. Anybody else have suggestions they'd like to make or things they've thought about that might be nice to include as we implement and manage these programs? So for all of the for most of the counties, we have 8 community support services, and there are 14 that are approved by the state. Do we need to look at those other 6 services that are currently not being offered to see if those would be helpful, like sobering centers, for example? Would that be a helpful community support service that could be added into our counties? Would that be something worth exploring? Amber, I'm channeling my inner therapist, trying to be okay with the silence. Okay, Kelly, I see you said yes. Thank you. Okay, so we can start to maybe explore that. And maybe if we have these meetings face to face in the counties, we can talk about what would be needed in each county and start to identify how do we work towards that. And of course, that would be important to have our partnership folks there too. So they can talk about what they're working on and who they've been talking to. So I think that would be something we can think about. So another gap that we have talked about before, and I think that we see, is that we have a lot of contracted providers who are not coming to our CPI. And so how do you think we could start to engage those providers differently and have them become part of our CPI network?
Well, for me, I think it's always about like remembering to explain the why, like why these meetings are important, how they can be a benefit across like our whole kind of continuum of care throughout all of our counties. And I think really just sometimes it also is about delineating, like I know with CalAIM, it starts to feel like there's so many meetings and so many things to do, like which one, but you as a leader don't have to be at all of them. So like identifying people on your team also that could come, but so your agency is still represented. I think we forget that our group has a lot of has a lot of amazing knowledge. And so just remembering, like, I think it's really cool that we get information from you guys. You guys are talented consultants and you have that like direct line to DHCS. But I just want to remind everyone on the meeting as well too, like you all have a lot of inherent knowledge and skills to like share with the group as well too, so that this is a successful implementation like across the board.
That's a good reminder, Amber. Thank you. So I'm going to put you on the spot here. What is your value statement for coming to the CPIs, Amber?
Well,
make her think. I love it.
for me, it really was understanding like this is the best way for me to get direct information to Department of Healthcare Services. That for me is like the best asset for my team, because I feel like my team's strength is that they're like very much doing the work with the people who this is really intended for. And that's really distant from like how DHCS created this. So for us to be able to give like really live examples, I think is really the wealth to it. I think also, you know, as much as CalAIM has tried not to be a siloed implementation, like there is like between DHCS partnership, you know, like there is a lot of different stuff. And so this has been a good place for me and my team to capture like things that we maybe aren't, you know, checking every day. Like we don't check the policy guides every day. Like maybe we should, but we're not. And so this is a great place for my team to kind of get those like, oh yeah, let's get this back in the mix of things.
And those are great. I think those are really important. Anybody else want to share what their value statement may be for coming to the CPIs, how we want to bring more people in? I'm going to speak for Spencer here. It sounds like it's also a great place to meet people to help build referral networks. Spencer, correct me if I'm wrong here.
Networks is really important. I go to a case management summit meeting in Shasta County quarterly, and I've been meeting a lot of new ECM providers. And it's been really nice that they've kind of come up and identified some of us at Shasta Community and other agencies like Visions of the Cross that have been doing it for a little while now. So they'll come up and ask us questions, and I usually like to refer to this meeting. And then, of course, the partnership roundtable meetings are really beneficial. So I like to get them into those meetings so they can get started and meeting with the teams on like how to build all of that up.
No, that's great, Shelley. That's a really important piece. Thank you. Anybody else want to add to that? All right, well then let's go into our next step. So one of the things that we want to get from you is more guidance about how Health Begins can support you all in the work you're doing and support filling or addressing any of the gaps. We've identified a lot of great things today. So I know my wheels are turning going, oh, what can we do? So that's been exciting. But I would love to get the next slide. We have a quick little poll here about just some ideas that we've come up with about how we could support. But if you have other ideas besides what we already covered today, please put those in the chat. But thinking about, would it be helpful to have like a MOU template, for example, of how we collaborate, how do we do referrals with each other? That could be one option. I know for the counties, they're like, don't talk to us about MOUs. There's too many other MOUs flying around. But for the CBOs, that may be something that's worth thinking about. We do have a referral or provider registry we've started, which is great, but would it be helpful to have a more comprehensive referral directory that we could share with the different folks in each county? Would a static asset map seem to make sense for folks? And I hear someone going off mute. Do you want to jump in here? Feel free to if you do. All right, and then the last option we've thought about, and again, you guys have better ideas, so please put them in the chat. What does a referral workflow guide look like? Would that be helpful in terms of encouraging more referral coordination? All right, and whoever's running the poll, let me know when we have responses in. I can't see those, so please let me know when it's good to share. Okay, great. So it looks like the majority of you think a referral workflow guide would be really helpful. That's really great feedback, followed by a comprehensive referral directory and then a sample MOU template for collaboration. Exciting. Yeah, all this sounds really good. Thank you guys so much for this input. And we'll be talking about this again next month around ECM. So if you have ideas that occur to you between now and next month's session, please save them and share them with us, or you can email us. We just were trying to think about what we can start to work on to continue this support for ECM and community supports and referral coordination. And with that, I believe I'm going to turn it over to Ava for the next slide.
Thanks, Gretchen. So we're just going to talk about a couple of next steps. Next slide, please. Just going to do a quick poll to get your thoughts on what section of today's session was most valuable. Was it the updates and resources section, the discussion about the lifetime benefit, or the asset mapping discussion? This will help us inform future sessions. Again, we always want to make sure it's the most helpful and useful content that we're including in these sessions. So I'll just give that another minute to get folks' answers. All right, so I'll go ahead and share those results. It looks like the updates and resources section was the most helpful. So that's really good information for us to have. Next slide, please. So for next steps, continue implementing your improvement practices, doing the great work that you're always doing in your communities. Our November session will be on November 19th at 1:30. There will be a registration link that's in our follow-up email to today's session. So keep an eye out for that and be sure to register in advance. And as I mentioned, we'll be holding office hours directly after this session. So you can stick around on this Zoom call. It's the same link. And we can continue the asset mapping conversation that we started today. But also if you have anything else that you'd like to discuss, that's a great space to do that as well. Next slide, please. And as always, we know this is a ton of information and everyone is sort of at a different step in their CalAIM journey. So we are always available for one-on-ones to do an overview of Medi-Cal transformation, to do an overview, again, if you're newer to the CPI, of what the Northeast CPI has covered thus far and the progress that we've made. strategies to engage with your MCP, or any other support. So please feel free to email me. My email is in the slide here if you'd like to set up a one-on-one with our team. And again, we always have office hours. Usually they're directly after the session like they are today. And this is a good opportunity to discuss things like funding opportunities, referral coordination, authorizations, TA marketplace, provider networking, to connect with partnership. And we also might, do specific provider spotlights or highlight specific resources. So keep an eye out for that. Next slide, please. But just thank you everyone so much for joining today. Thank you for your contributions and the robust conversation. We will follow up with more information about the next session. And I hope everyone has a great rest of their week. Thank you.
Thank you all. Have a great week and happy Halloween.